Thank you very much, Chairman Gonzalez. Distinguished members of the committee, thank you very much for allowing us to be here today to discuss our issues that have to do with CMS regulations and programs on small health care providers, particularly those of us in home health and hospice. I am a registered nurse and the owner and administrator of Nurses in Touch, Inc., a Medicare-certified home health and hospice company. Currently, we serve about 280 patients. I have a 16-county area, service area that we cover, and we have employed 185 people. I'm also here today as the president-elect of the Texas Association for Home Care, and it is a nonprofit trade association, and we have 1,200 agencies in that group that provide home health, hospice, and personal assistance services in Texas. Because of the time constraints, you have my written testimony, but I want to go over the 5 burning issues that we have. The first issue deals with employee staffing. We need flexibility to use contracted staff to meet the unique needs of our patients and to accommodate a fluctuating caseload. This is especially true for small home health agencies who serve primarily rural areas like mine. This is an issue because current CMS rules limit our ability to use contracted staff. As an example of this, if a majority of my nursing staff became ill with the flu and could not conduct their patient visits, I would not have the flexibility to use a staffing agency, yet hospitals are allowed to use this contracted staff. We believe CMS should allow the same flexibility. Second, in regard to home health, to telehealth and telemonitoring, CMS does not recognize the technology and visit costs as reimbursable under the current Medicare home health benefit, even though CMS encourages the use. Telehealth and telemonitoring methods are used by agencies to monitor patient care without the nurse being present in the home. These monitors can assess vital signs, weight, and other valuable parameters that alert the home health nurse to potential health problems and possibly averting a visit to the emergency room or even hospitalization. And if CMS moves to a pay-for-performance model, those of us unable to invest in these technologies to the degree that larger agencies can will certainly be at a disadvantage. Third, gas prices. They've had an immediate impact on home health and hospice care. Ladies and gentlemen, we drive to see our patients. We don't walk down hallways to see them. Last year, my staff drove 700,000 miles to see our patients. And it's not unusual to have one of our nurses drive as many as 100 miles in a single day. We are concerned that the rising prices have deterred nurses and therapists from even working for home health and hospice agencies. Larger agencies can purchase fleets of cars for their employees, something that is not possible for small agencies like mine to do. With no end in sight to rising gas prices, we would like CMS to take into account increases in gasoline prices when determining our reimbursement amounts. Our fourth issue has to do with who is allowed to sign orders for care. Currently, CMS rules require physician certification on home health plans of care. And that means that for home health, nurse practitioners and physician assistants are not allowed to sign plans of care, even though they are allowed to do so in other health care settings. And ironically, CMS did allow them to sign these orders on hospice patients. So the question would be, why not home health? Not only would allowing them to do so expedite patient care, it would also reduce our administrative costs and allow us to bill more timely for the services we have provided. Congress should enact legislation to instruct CMS to allow nurse practitioners and physician assistants to certify and make changes to home health plans of care. Fifth, regarding contingency plans for claim payment delays, CMS should be required to have a contingency plan in place, and these plans should be accessible for all Medicare providers, especially when there are changes in reimbursement systems that impacts claims payment. And in conclusion, Chairman Gonzalez and distinguished members of the committee, I want to thank you for allowing me to be here to testify today, and I would be happy to answer any questions.